Hi, all. Thanks so much for joining. Speaking of making healthcare work for you, different perspectives and empowering solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta. And today we welcome JC Adams, who is the founder and CEO of Cloud9 Telehealth. Thank you so much for being here, JC.
Thank you for having me.
Cloud9 is a pretty revolutionary product that you have. It's a platform that connects people in underserved communities who are at risk for substance use or mental illness, and puts them in touch in a virtual world with providers and first responders so that everybody is able to better help this person in the ways that they need, and also better protect both the patient and the first responders and the other people they're interacting with, because it allows first responders who may be going to a call at that person's house to know this person has a particular mental illness or certain other issues. So they better go in better prepared. So tell us, I know that this started with an intensely personal reason for you. So tell us why you started Cloud9 and how this is making a difference.
Thank you for asking. Yes, I'm an entrepreneur with experience in technology and business, but I was called into this space because I'd lost 9 friends and family members to untreated behavioral health issues. And all I had was an understanding of the challenges and the barriers to care, a lack of providers, lack of reimbursement, geographic issues for those in rural areas, and stigma being one of the biggest. So I was very fortunate to pull together a team of industry experts that understand the provider side of the equation, the payer side of the equation, and the clinical needs of individuals that we can apply technology to. So yes, and our focus is on helping underserved, high cost, high need individuals. As I was learning the space and going through accelerators and seeing other companies that were working, they were really serving more affluent people served by major hospitals and health systems, people who had private insurance, and unfortunately the people that have the most need, the bulk of the population with the greatest need is really is covered by Medicaid, or they're even uninsured. And those are our people, and those are the ones we take care of.
So you're connecting the dots for a very, very challenged, vulnerable population. How do you make it work, JC? What's the secret to doing that? It feels like it's a lot of work and a lot of disjointed pieces. So how is Cloud9 succeeding at making that happen?
Often these individuals have complex physical and mental illness and addiction needs combined, chronic co-occurring conditions. And we've worked on a first version and a workflow of our telehealth solution that just helps these individuals get served by a collaborative care team of not only mental health clinicians, but also being able to collaborate with primary care, nurses, substance use recovery specialists, and social services when we're trying to address social determinants of health needs. So connecting them to also food, clothing, housing, childcare, and employment services. So we designed a system that allows the patient to be surrounded by an entire care team and a safety net so that they can get the services they need when they need them. And that was a architectural challenge, but also a workflow challenge to the healthcare providers to change the way that they collaborate. They were never able to do this before. And with data and communication technologies that are available today, now they can collaborate in real time to help individuals when they need it. Too often, individuals with untreated mental illness get caught in this failed cycle of non-treatment and readmission and driving high cost and waste by when a 911 call happens for a mental health crisis, people too often have a bad encounter with a first responder, such as law enforcement, or they're dumped at medical emergency rooms, which are getting clogged up with behavioral health issues. They don't have the staff to treat them, or they're taken to the county jail. And as your audience may not know, this disturbing fact about the United States of America is ever since we've deinstitutionalized and not really funded community mental health services, is that county jails have become the largest mental health facilities across the country, and we warehouse people there. And there's this terrible, there's some common terminology such as you cannot get well in a cell. And what we were able to do here at Cloud9 is create a model where we can bring in the first responders to this collaborative care communication I just described to you. And they, at that point of contact from the 911 call or the encounter, they can have information that can help them have a safe encounter and immediately put the individual in touch with a care team member, which can further de-escalate, prescribe meds, or route this individual to social services, a friend or family member's home, bring in mobile crisis teams, or take them to more suitable diversion centers or a psychiatric hospital that can help them.
So you said that county jails are actually the largest mental health facilities in the nation. And by using Cloud9 and being able to connect these people to the providers that they need and help first responders better prepare for these situations, you've been able to save billions of dollars and help people get treatment in the appropriate way, rather than just putting them back into jail or into a hospital and driving up costs that way. So tell me, how have the results of using this changed? Because you said that they're even better than using ride-alongs.
The University of Texas data off phase 1 of this pilot showed that 97% of Cloud9's consults were superior or equal to having a ride-along clinician. Phase 1, the first time we tried this, it generated immediately a 632% return on investment for Houston and Harris County. But the bigger number was that we initially, in that first phase, decreased mental health crises landing in ERs and jails by 22%. So in Texas, when a 911 call lands in emergency rooms and jails, that wastes $2.6 billion each year. So you can imagine how reducing that by 22% would save a large amount of money for our largest city and county in the state. Economically, this was a big win because it's much more efficient to have a clinician either at the community mental health center or repurposed to be trained to be at the 911 call center as a call center clinician. And from there, they can use our technology to share information with first responder vehicles all over a community, even far out into rural areas, so that they can have eyes and ears on the scene.
There's a lot of information, JC, that you're providing us. And again, to help me specifically, as well as our audience understand this, I think what I'd like you to explain to us is, you described a model in which the first responders, EMS, the police are coordinating with the clinicians. But yet in most communities that we are familiar with in the US, that collaboration doesn't exist. So how do you go into a community and create that collaboration? Or are you going into communities where that collaborative model is already in place and now you're providing them with the technology?
What we found is this is such a big problem. Large major metropolitan areas, highly populated counties, and even suburban and some larger rural cities and counties are already trying to solve this. And there usually exists in each community a stakeholder group or a committee or a board that meets on a regular basis, let's say monthly, that will have someone representing the community mental health center. You'll have someone from the city and county there. Typically, a county judge is very involved in this, as well as first responders, EMS, but mainly the police chief and the county sheriff will have a seat at the table. And in a really good stakeholder group, you will also see representation by consumer advocacy groups, primarily NAMI, the National Alliance on Mental Illness. So that's the perfect audience to introduce this option to. go to find those communities that already are thinking about this problem or have already introduced a co-responder model. And we can go in where a co-responder model doesn't exist. So those are the two best starting scenario communities that we would look at.
One of the things you mentioned just a little while back is that the return on investment has been really tremendous. I think you mentioned something like 600% or plus. What it makes me think of is you started Cloud9 because of near and dear friends and family members that were unfortunately lost to mental illness. And I guess what I'm trying to understand is, how is Cloud9 changing the outcomes on that end? They may not be numbers, but they may be some anecdotes or some stories or some way in which you know that what the service you're delivering is ultimately meeting the objectives from which it was designed.
I grew up in a rural area, and there just simply were no clinicians available to serve that community. And the technology didn't exist for telehealth or telepsychiatry. So from a prevention standpoint, ongoing services could have been very beneficial to some people I knew. I have also known people who were involved in the judicial system because of their untreated issues. They would get in trouble and come in contact with first responders, bad encounters. And once the wheels of justice start turning, once that's your entry point, it's hard to stop them. And I have a relative that's been incarcerated most of his adult life because of untreated bipolar disorder. So yes, if a law enforcement officer would have been aware of his condition and been able to route someone like this to care services, that could have been avoided. I'd mentioned that initially there was that 632% return on investment to the customer. What that was doing was comparing the cost of a ride-along program, staffing an individual, and instead paying clinicians their market rate to provide services remotely and to access data and share information. That was a way of them calculating how many more people they could serve much more efficiently with this new model. Because again, the clinician can be used on demand and be anywhere in the community. And the additional outcomes results, which you asked about, since the initial phase 1, we had shown that 22% decrease of these mental crises landing in ERs and jails. Well, now that program has expanded, and we're seeing over 50% diversion rates, keeping people out of jails and routing them to social services, mental health care services, keep getting them to a friend or family member's home or the proper facility. And it's growing and increasing, and it's taking off around the country where people have found out about this. And they're realizing that this is a much, much more efficient solution than the innovation we were just announcing of ride-along programs just a couple of years ago.
I think that what you're doing is so innovative. And I think it's also impressive that you've told me before that the primary payer for this is Medicaid, which is not a program that a lot of people have a ton of praise for. And somehow you've managed to find a really efficient way to work with them that is saving everybody a ton of money. And along the same lines, you also told us that you recently started an additional company called Shiine, which provides peer-to-peer support and allows those people who provide that support with lived experience to get paid for their help. So it's a way that you're working to solve the shortage. So tell us, with all of your work at Cloud9 and then also adding in Shiine and your ability to find creative ways to truly make a difference in this for people and in the world of mental health and substance use, what keeps you going? What fulfills you the most? Like, wow.
It wasn't easy to figure out how to get, for instance, government agencies to pay for low-income populations to have access to mental health. It wasn't easy, but we were fortunate to have persevered and figured it out with Cloud9. But it still does not solve the shortage of mental health clinicians. We're just not educating and training enough individuals out of our universities to be licensed clinicians. But peer support specialists have been proven for decades, the first example being an Alcoholics Anonymous sponsor. But peer support specialists also have lived experience overcoming mental illnesses, as well as other substances other than alcohol. And they share their lived experience, and decades of research has shown that they have a transformative effect on individuals and communities by increasing people's engagement in mental health and substance use services and improving people's overall health, including these chronic co-occurring physical illnesses like diabetes. What we're doing there is we're building a community to help support peer support specialists who were originally a volunteer group of people that has grown. And now Medicaid is finally starting to pay for those services. Previously, peers were paid by state, county, and some federal funding sources to pay them, a very basic minimum wage. And a little bit of a correction there, Stephanie. I wouldn't say Medicaid's always our primary payer. The uninsured population is often funded by these same federal, state, and local funding sources. But yes, peer support specialists, if we build a community for them and technology where they can be freely accessed by consumers, and we've also designed something very innovative at Shiine using a blockchain backend, tokenization as a way to get additional compensation to these peer support specialists so that they can be funded to do this valuable work that they do and the great value that they add to communities. So that's what's different about Shiine.
Thank you so much for being here and sharing this. Cloud9 is doing amazing work, and I'm excited to see how Shiine expands.
Thank you.
Yeah, it's just truly remarkable, JC. Thank you for being here with us.
Thank you for your advocacy and spreading the great word about innovations in our space. It's needed. Thank you.
And thank you all for watching. Bye-bye.